Assalamu alaikum. Today we will discuss the lecture on compliance. It is the continuity of vascular distensibility. In this lecture we will discuss compliance and then delayed compliance. So firstly, what is compliance? Distensibility times volume. That means that multiply distensibility with volume is equal to compliance. So compliance and distensibility are quite different. A highly distensible vessel that has a slight volume may have far less compliance than as much less distensible vessel that has large volume. So if a vessel has more distensibility, it may have less compliance. You can also clear this concept by the following example. The compliance of a systemic vein is about 24 times that of its corresponding artery, because it is about 8 times as distensible as it has a volume of about 3 times as great. So the compliance of a systemic vein is about 24 times that of its corresponding artery. Why? Because it is about 8 times as distensible, as you have studied in the previous lecture, that the veins are 8 times more distensible than veins. So when they are 8 times more distensible, they comprises a volume of 3 times greater. Okay? If it is 1 time distensible, then the volume is equal. So if when it is 8 times more distensible, the volume becomes 3 times. So 8 into 3 is equal to 24. So distensibility times volume, that means distensibility into volume, 8 into 3 is equal to 24. So the compliance of systemic vein is about 24. And there is a concept of mean arterial pressure, average of the arterial pressure measured milliseconds by millisecond over a period of time. And it is not equal to the average of systolic and diastolic pressure. I usually say that this is not so mean. This mean arterial pressure is not so mean. That means that you should not calculate it by adding systolic and diastolic and then divided by 2. That means that systolic is 120, diastolic is 80, 120 plus 80 over 2 is equal to 100. So this is not correct. So if how we will explain it? It is not equal to the average of systolic and diastolic pressure, because the arterial pressure remains nearer to diastolic pressure than to systolic pressure during the greater part of cardiac cycle. So the arterial pressure is normally close to diastolic pressure. Therefore, the mean arterial pressure is determined about 60% of the diastolic pressure and 40% of the by the systolic pressure. Because it is more close to diastolic, that's why the part of diastolic is 60% in calculating the arterial pressure. Mean arterial pressure is equal to the equation of mean arterial pressure is diastolic pressure plus 1 over 3 pulse pressure. So how we can calculate pulse pressure? Firstly, we should know about the pulse pressure. The difference between systolic and diastolic pressure, very simple. Pulse pressure is equal to systolic minus diastolic, for example, systolic is 120, diastolic is 70. So the pulse pressure comes to 50. So systolic minus diastolic is pulse pressure. And here is, you can see here, diastolic pressure plus 1 over 3 pulse pressure. Diastolic pressure, as you have see here, is 70. So diastolic pressure is 70 plus 1 over 3 into pulse pressure. What is pulse pressure? 50. So 1 over 3 into 50, it approximately comes 13. It approximately comes as 16.66. When you divide 50 by 3, 120 minus 70 is 50. So your pulse pressure is 50. So when you divide 50 by 3, it comes 16.66. So 70 plus 16.66 is 86.66. So this is your mean arterial pressure. So the equation of mean arterial pressure, you should know, it is very important. Diastolic pressure plus 1 over third of pulse pressure. You have studied pulse pressure. Factors affecting the pulse pressure are stroke volume, output of the heart. You have studied what is stroke volume, the amount of blood pumped by each ventricle per beat. That is about 70 ml. So first factor is stroke volume, which affects the pulse pressure. Other is the compliance. You have studied it. The compliance. Stroke volume has direct correlation. Stroke volume increases, pulse pressure increases. But when the compliance increases, distensibility times volume. When the compliance increases, the pulse pressure decreases. Why? Because pulse pressure is a pressure. While compliance, during compliance, there is distension, there is dilation of the vessel. So when the vessel is dilated, the pressure drops. And a characteristic of ejection from the heart during systole. So this is the other factor which affects the pulse pressure. Pulse pressure is determined approximately by the ratio of stroke volume output to compliance of the arterial tree. So both of these factors, stroke volume and compliance, affect the pulse pressure. Any condition of the circulation that affects either of these two factors also affect the pulse pressure. Very simple. And the second part of this lecture is delayed compliance or stress relaxation of the vessel. The term delayed compliance means that a vessel exposed to increased volume at first exhibits a large increase in pressure, but progressively delayed stretching of smooth muscle in the vessel wall allows the pressure to return back towards normal over a period of minutes to hours. So firstly, when the volume is increased, the pressure is increased. But after a few movements, the smooth muscles of the vessel stretched, and they remain stretched. Delayed stretching, that they remain stretched. And when they remain stretched, there is more space inside the vessel. And that's why the increased pressure comes back to normal over a period of minutes to hours. So this is the concept of delayed compliance. You will also study it in the mechanisms of blood pressure regulation, intermediate blood pressure regulation mechanisms in the upcoming weeks. So firstly, volume increases, pressure increases. But when the pressure increases, the blood vessel dilates because the pressure is exerted laterally on the blood vessel walls. So when the walls are dilated, the pressure drops. But it takes time. That's why it is delayed compliance. An extra volume of blood is suddenly injected. You can also clear this point from this example. An extra volume of blood is suddenly injected until the pressure rises from 5 to 12 millimeter of mercury. Even though none of the blood is removed after it is injected, the pressure begins to decrease immediately and approaches about 9 millimeter of mercury after several minutes. So by injecting the blood, the pressure rises from 5 to 12 millimeter of mercury. But after a few minutes, the pressure comes back from 12 to 9. Why? Because of delayed stretching, because of delayed compliance. Because when the pressure increases, it inserted force on the walls of blood vessel, and when there is when they are applied a force on a blood vessel wall from inward outward, from inward to outward, the vessel walls become dilated, and this dilation causes drop in the blood pressure from 12 to 9 millimeter of mercury. In other words, the volume of blood injected causes immediate elastic distension of the vein, but then the smooth muscle fibers of the vein begin to creep to longer length, and their torsion correspondingly decrease. So there is elastic distension when blood volume is injected. But the smooth muscle walls are elastic, so they distend or dilate, and the diameter increases and the pressure decreases. Delayed compliance is a valuable mechanism by which the circulation can accommodate much extra blood when necessary, such as after 2 large transfusions. And delayed compliance in reverse direction is one of the way in which the circulation automatically adjusts itself over a period of minutes or hours to diminish blood volume after serious hemorrhage. So after serious hemorrhage, due to delayed compliance in reverse direction, there is contraction of the vessels, and there is less loss of blood from the site.